All right, action.
Okay, fibromyalgia, something I want to talk about. So we've touched on this a lot before, right? Fibromyalgia, one of the most common things we're going to see as natural medicine practitioners. Why? So we better well know this. What's that?
Because it's highly overdiagnosed.
It's highly overdiagnosed sometimes. Sometimes it's like underdiagnosed, right? Some doctors don't even believe this is a disease. We're gonna see a lot of this because there's no medical cause. There's no clear medical cause, and there is no medical treatment. So estimates range from 4 to 12 million people in America alone have fibromyalgia, because it's not diagnosed a lot in some people. Some people never talk about it, especially men. Women are more likely to have it at least diagnosed by a ratio of 8 to 2. So 8 times, for every 8 women that are diagnosed, there's only 2 men that have it. That could be a lot of reasons. Whether it's hormonal possibility or the fact that a lot of men don't go to doctors for chronic pain. It could just be all kinds of different reasons. But it's interesting, for sure. I think also when men there's such a label with this disease. I've really seen so many people suffer with it. When men tend to have fibromyalgia, it's kind of more like this is the world is kind of like, what the hell's wrong with you, right? Like, man up, get over it, do it. Where this is not how fibromyalgia works, right? It's like you can tell somebody a fibromyalgia that it's like, that's depressing, right? Because they're suffering and they can't do what they want to do. Often medical doctors just label this as psychosomatic. This is where they go. Mostly because there's no medical treatment. So people end up at massage therapy and natural medicine and all kinds of other people looking for support, right? I will just say, like, I really have, knock on wood, I've never really known someone with fibromyalgia that didn't have like almost a total full recovery. And my entire life and career, I see people like probably once a day at least. Well over 20 years, even before I was practicing full time. It's just such a simple protocol to help people get through. That doesn't mean the recovery process is simple, but that I've never seen. I've always have seen people just get back to normal life. I don't know if we want to call that a cure. I'm just calling it to get back to like where they feel like it's not affecting them anymore. So, the really wise herbalist Pete Kalsa had a great quote years ago that I've loved, and I truly believe that his quote is, "Fibromyalgia is not a muscular disease. It is a metabolic disease," which I totally agree with. And stress obviously has like a huge factor of fibromyalgia. One of the most stress triggers, stress induced, stress worsened kind of like diseases that we have. So fibromyalgia is not a muscular disease. It is a metabolic disease. Which it is, right? Meaning this is why natural medicine has such a good track record with helping fibromyalgia so effectively, because you recognize all these different causes and triggers for it, right? So fibromyalgia is really common after stress, after pregnancy, after hormone changes, after psychological trauma, after physical trauma. Very, very common after viral infections. I mean, we know there's often a really clear immune trigger for a lot of people. emotional stress, hormonal change of any kind, men or women, like testosterone, progesterone, estrogen. This is why it's really common after pregnancy for women to develop this. There's all kinds of things that have been linked with it, right? All kinds of immune things, stress things, other metabolic, adrenal, hormone. There's so many things to talk about. That's what's, I think, why Western medicine struggles with it, because they're not able to see everybody's different that has fibromyalgia, and they're not able to recognize that there could be all these different reasons why people have it. And their experience of it could all be very different, right? Some people are going to have more fatigue of fibromyalgia, and that's their symptom. Remember how we talked about when people come to see us, when they say a disease name, we're like, okay, I recognize that, and then we just erase it, right? We're starting from scratch with pattern identification, right? What is the pattern that this person has? Because with fibromyalgia, we're going to see a whole host of things, right? We're going to see fatigue, and often that's people's main thing that's affecting their life. Brain fog, super common. All kinds of these weird immune symptoms that we'd love to see as herbalists, right? Where people are always getting chronically infected. They feel run down all the time. People having these low grade, like fevery responses, people having these kind of like cyclical, almost like they're getting an infection and they feel achy and feverish, flu-like, and then it goes away and comes again. Brain fog, memory loss, anxiety, muscle tension, muscle stiffness, neuropathy pains are really common with fibromyalgia. Some people actually have joint pain, tendon pains, ligament pains, swollen lymph glands and lymph tenderness, chronic allergies, all kinds of digestive food allergy type symptoms. So it hits on so many areas. The first thing we have to do as practitioners is just say, okay, I recognize this. First of all, by us saying, oh yeah, it sounds like you have fibromyalgia, that's a really difficult experience. Most people just start bawling immediately. They will. They're just like, oh my gosh, you don't think I'm crazy, you don't think I'm weird, you don't think I'm lying, because there's nothing worse than feeling crappy and having somebody say, like, your spouses or family or friends or coworkers or medical professionals even say, yeah, fibromyalgia, that's not a thing, you're just weak or wimp, or just get over it, or go work it out, like work out till you feel better. Yeah.
A lot of these symptoms sound similar to adrenal fatigue. So how do you tell the difference?
Most people, when they come to see us, that have a diagnosis of fibromyalgia, if they don't, we're kind of thinking about it, but to us, it doesn't really matter because we're still just going to treat the pattern.
Okay.
Yeah. What really is, and we want to ask them, like, okay, you have all these symptoms. There's a lot of people have every one of those symptoms, right? Which one is really affecting your life the most? Which one is it? Because some people, it's more these weird, like pain, like nerve-like pains in their muscles. Some people, it's just like classic fibromyalgia, muscle ache. Some people, it's just stiffness. Some people, it's neuropathy. I've seen a lot of people with neuropathy that has been diagnosed as fibromyalgia, like the hands and feet, that it just looks like their only symptom is neuropathy, burning hands and feet. So it's just kind of, people are all over the place with this. So we want to ask them, what are all your symptoms? What is that like? And then we always want to ask them, right? Like, how much stress do you have? Because fibromyalgia said is always worsened by stress, triggered by stress. To me personally, like what I have seen with people is that people that have fibromyalgia or the symptoms of it often have a deep pain and ache in their life. And it's usually with someone that's very close to them, like a parent, child, spouse. And they just can't deal with the pain of it. It's like overwhelming. So there's often, when spouses have this, it gets to be, it's interesting to kind of just look how it moves through their relationship. Okay. One of the biggest problems with fibromyalgia is that a lot of people have so much aches and pains, especially what I would call like the achy muscle type of fibromyalgia, that they can't sleep. And then this gets to be a vicious cycle, right? You can't sleep because of the pain, you get more stress, all those things start to trigger the fibromyalgia worse. And then now we have this like really vicious cycle. So we want to also ask people a lot about what is their pain level like? What is their quality of sleep like? And you got to really ask people, right? Like, why are you getting up at night? Or why can't you sleep? Are you anxious? Is it this ache or pain? A lot of people have to roll over like every 30 to 60 minutes. It's like restless sleep. Some people just have headaches with fibro. I mean, that's what we just have to really figure out what they're talking about.
You see a lot of RLS with it too. Restless leg.
I think restless leg syndrome is pretty common with like the muscle, what I call the muscle achy variety.
Yeah.
So sleep is going to be essential for helping people to recover from fibromyalgia and to have a full recovery. And also just managing stress. And remember, people don't have to become Zen monks, right? Here we're just talking about people just have to get better at managing their stress. When more than any other disease, maybe other than cancer, when people come in with fibro, we want to know exactly what is your level of support system of the family structure. Do you have a spouse, parents, friends, children, grandkids, grandparents? Like, are you really being supported or not? That's going to help us know like how that's really going to determine, in my mind, mostly like how quickly they're going to recover. Are they like everybody in their family like burn bridges and just other stress and drama of all their family members, or maybe people just think they're literally crazy, or they're faking it or something, or you hear this a lot, family members will say you just want attention and you're just faking it and all this stuff. So we want to know like what's the support system like? What's the level of stress and support? Because that's going to really, to me, determine like how quickly people can go. Okay. Obviously, like everybody in your family thinks you're faking it. That's like really hard to get better. You just on a practical level, and that happens a lot. A lot of people that have never had it just don't get it, right? Okay. One of the other challenges with fibromyalgia, like adrenal fatigue, is that as people feel better, they immediately want to like push themselves, right? So as they're, whatever symptom it is, whether it's the aches or pains or fatigue, people want to start working out more right away. Or they want to start staying up later, or they want to start taking on more responsibility, or doing more, And I always tell people just, and I see it all the time, that people are starting to make a really good recovery. They get excited, just like with adrenal fatigue, right? It's the same thing. We all do it as humans, right? You feel better, we want to like take it on. But I can't tell you how many like doctors, physical therapists, trainers that have just like really push people into like ultra aggressive workouts right away, and people just get floored. They get like totally floored. You just gotta like ease into it. What's your training fibromyalgia approach?
I mean, like massage wise?
Just with other like training advice to like the clients you see with fibro?
Like ones that want to work out?
Yeah.
I will, because I've seen lots of fibro and it does always vary, just like you said.
Yeah.
I always ask them what helps you feel better? Is it more like yoga and walking? Usually impact makes it worse. I haven't found a single one that's like, yeah, running's amazing. So usually it's things like yoga, walking, a lot of them, Epsom salt baths are big game changers.
That's a good one.
Huge game changers. Regular massage. And generally, I can't use a lot of pressure, like it's medium to light pressure.
Yes, that's a good point.
But as far as activity level, I always talk to them about how they feel. How does your body feel afterwards? How do you feel days afterwards? If they're like, yeah, I did this thing and I was fatigued for 2 days, so that's not a good thing to do. So we're not going to do that again. We're going to pull back, but I do that all the time. Well, you used to, but if you want to heal, you need to rest your body. So you're going to need to not do that.
Yeah.
And I'll talk it through with them. Very few of them are like, yeah, I lift weights too. Like I don't hear that from a lot of them. It's almost always walking, yoga. It's not kickboxing, sometimes biking or the cycling classes sometimes, but
I mean, most people as they recover, they're eventually a lot of people get pushed into working out with weights, and that's like the most cautious thing you need to have with fibro is that I've seen people have a full recovery and then eventually go to weights, and then at that stage they just collapse into like flu-like, everything to come back. So I mean, they were able to work back through it right away, but it's just, working out with weights is just like the thing you want to most ease into. But yeah, yoga, tai chi are like the best starting places. I think they're fibromyalgia like remedies.
I've had a few do stationary bikes, stationary rowing, things like that have been all right.
Yeah, swimming's really
Swimming,
good too.
yeah.
But yeah, so just a lot of people you have to just say, because I can't tell you how many people I've just said, they said, yeah, I started to feel, I went to a trainer or my physical therapist or doctor, they said, just kind of, you got to push through it. I worked out and I felt horrible. And then like a month later, they tried again. I'm just like, yeah, you can't do that. And then they just start like crying, like, well, I can't believe you know that. It's like, I mean, it's just common sense. I don't know anything. I just know it's not good for fibromyalgia until you're fully recovered. And people just like, it's just amazing how relieving that is for you to just say, yeah, that's not in your head. Like that's just a real common experience with fibro.
Even with, I have adrenal fatigue, I don't have fibro that I know of. I've never been tested for it, but I love lifting weights. That is my thing. When I have a bad fatigue day, which I still have sometimes, I just cannot lift as hard.
Yeah.
Or as heavily, or maybe we have an hour and I might get 40 minutes in. I look at my coach and I'm like, we're done.
Yeah.
And he's like, okay, just go like row slowly, walk on the treadmill, go like get a good cool down for the rest of your time here. You might as well. But I love lifting weights, but there are days I can't lift. I can barely lift a bar. And then there are days I can overhead squat 135 pounds and I feel fantastic. So it just varies. The healing is slow. You have to be okay with that because no matter how impatient you are, that will not speed it up. Learned.
So yeah, stress management is going to be essential for managing fibro. One of the I think I've talked about this with any disease, but with fibro especially, I think I've told people anxiety is the same way. The worst thing for fibro and anxiety is sitting at home alone. That's just the absolute worst thing you can ever do for your health and mental health. So the people that I've seen that were really isolated were the ones that had the hardest times recovering. So just sitting home alone where you're thinking about the pain you have. And not that we're pushing people into working out, but here we're just getting people to just engage life and to kind of like, we can sometimes in a good way distract ourselves a little bit from some of the experiences we're having in our life by just keeping active and getting into hobbies again and interacting with nature and the world. So all the people that I've ever seen heal the slowest either had no support system or they were just, literally no support system, were just home alone all the time. Most of them were not working or not able to work. And that is a challenge, because then you're battling your mind, your battle with mind. Fibromyalgia, like a lot of diseases, you can't outthink it. Right? You're not gonna sit at home and like outthink it or out emotion it, right? It's a process that requires you to really address the body and nervous system and immune system and like everything at once, the adrenals. So it's very just complex, right? Okay. And the other point was brought up too, that fibromyalgia is not usually a disease that responds well to really aggressive, like deep massage. Some people might ask for it, but I mean, a lot of people can really beat up. It's one of the things we usually tell people too, is like, again, you know, they'll start crying, like I keep getting massage. That's really aggressive, and I feel like I got ran over the next 3 days. You know, it's like, well, it's probably just tell the therapist, like just light pressure. Like, you know, start crying, like, why? No, I don't know why I couldn't say anything, you know. A lot of times with fibromyalgia, there is this, a lot of times people don't have the ability to speak out very well. It's a common trait too. Okay. So as people feel better and their energy improves and all their, if they're having aches or pains and all that, as that all improves, you can naturally, they can start to do more. There just has to be this real, this natural progression. Like you're saying too, if you're just being intuitive about how you feel. Okay. If you don't trust yourself and your confidence is low and you feel totally beat down by life, like you're not going to even have the confidence to trust what you know already, right?
Those are medical professionals tell you to be intuitive about how you feel.
Right,
And if
Right.
your family is saying, it's in your head, or you're doing it for attention,
right.
that's hard.
Yeah, that's like, there's a lot of just, psychology challenges with fibromyalgia, for sure. You've got cancer, everyone's like immediately like empathetic, understands, like fibromyalgia is just one of the most polarizing diseases that people are either like in one or two camps, like super supportive or just like, yeah, it's in your head, it's fake. I can tell you how many doctors have told patients that, like, you know, there's no medical reason. Fibromyalgia is a fake disease. You are just, this is all in your head, like literally. So, I think there's been a lot of progress in the medical world, but there's still no known cause. There's still no medical treatment. There's still nothing there. So this is probably, if you're going to see patients ever, you're going to see fibromyalgia probably as much as anything, percentage wise. So just really good to understand it. Just really good to be able to relate to people. Okay, we do it on time. Okay, so we're going to go through, as we usually do, the patterns of fibromyalgia. This is where we're really going to customize an approach and customize our understanding of a patient, right? This is kind of like our assessment process. This is our program process. This is our recovery process. This is our listening process. So we're going to go through all these different patterns and action categories and kind of understand, what is this? What are we saying here? Okay. So the first group that we're going to stumble upon is the antispasmodic. These are the usually nerve type herbs that are the best remedies we're going to do when what type of pattern is clearly existing.
The muscle aches and pains.
Muscle aches. I should just write this down as I go. I do have notes for this, by the way, but I'll try to edit. So muscle aches, muscle pain, muscle stiffness, muscle tension, muscle spasms, like the restless leg syndrome that was mentioned. Right? Any kind of myalgia or muscle pain of any kind. Okay. So again, we might have 5 or 6 or 10 different things. This is where we're gonna have to like start sorting through this. This is where we want to ask the patient to, how bad is this? Is this like one of your worst symptoms? Because they'll be able to tell you that, okay? So these are, traditionally, they're in a really weird niche. We call them antispasmodics. They're all nervine herbs, in a sense. But these herbs, this historically, clinically have a really cool little niche. And these are like if there was like a medical fibromyalgia herb, these would be the category of fibromyalgia herbs from like a medical perspective, like muscle ache, pain, stiffness, muscle inflammation, muscle everything. Okay. This is also going to be stress manifest as increased muscle aches and pains and stiffness, right? Or if you exert yourself, you're going to have worsening muscle aches, stiffness, pain. Okay. Okay. So we'll start with the main herbs, and then we'll work our way through this here. The main herb in this category, everybody needs to know, is black cohosh root. This is a cooling antispasmodic. Just everybody should know the number one herb for fibromyalgia in most situations is going to be black cohosh. Like we've talked about a lot, what is the number one problem with using black cohosh though? Clinically, or sending a patient to a store to get it, what's the biggest challenge we're going to run into? Most of the products at the store are going to be processed and the plant is going to be altered to favor all the hormones just for menopause or hot flashes. So here, the challenge is finding an actual whole plant, non-processed black cohosh root, like a tincture of black cohosh, or just a capsule or a tea. Or there might be some concentrated capsules, like Gaia makes just a very concentrated black cohosh capsule. But here we want this plain black cohosh, because if we take those other products, it's not going to work for this. Okay. And black cohosh is classically indicated for flu-like symptoms, chronic muscle aches, pain, stiffness, cramps, trauma, right? Trauma to the muscles, restless legs, myalgia, any kind of muscle pain or ache or stiffness. It's the greatest herb for that. That's what it's, and even more than menopause, this is like the greatest use of this plant. It works so often. This is one of the top 5 fibromyalgia herbs. Would not be able to do the work with patients without it. Also, fibromyalgia, like when people feel their muscles, right, and they palpate them like they are tender to the touch. That's like a important. Muscles are tender to the touch. Okay. Black cohosh, we know, is also very cooling and it's good for menopause. So if we have maybe a female who has fibromyalgia that has showed up kind of around the menopausal time of life, this is a great remedy. This is one of the great trauma remedies, remember, for whiplash and car accidents and car trauma. So someone's fibromyalgia might have been triggered by muscle spasms and trauma from like an accident or an injury. This is another great use of this herb. Okay. The next one in this category is we can do either one. black haw bark or cramp bark? So black haw bark is more nervine than black cohosh. It's a little more nerve calming. And it's also a little more muscle relaxing. We would actually call this, these herbs would be traditionally probably be called muscle relaxers too. But black haw is even more muscle relaxing when we're having a lot of stiffness, cramps and spasms in the muscles. It is good for the achiness, but black cohosh really excels for the achiness in the muscles. We've also talked about black haws being very, very good for high blood pressure, anxiety, menstrual cramps or pains, premenstrual cramps or pains. So in women, when we're talking to them, if during the premenstrual phase or menstrual phase of their cycle, fibromyalgia symptoms intensify, this is a really good herb to consider. The difference between the two, they're really very, very related plants. I just have always found black haw to work better for fibromyalgia than cramp bark. Cramp bark is good, but to me, black haw just has always worked better. I don't know why. There's a little different chemistry. Okay. The other herb that's in this category is our good old friend wood betony. Really powerful. Another top 5 all-time herb for fibromyalgia because it's good for muscle aches, pain, stiffness, cramps. And it's also a great stressor of the nervine, right? One of the best nervine herbs. Okay. So wood betony, we've also talked about it for head trauma and headache. Here we're talking about the patient's going to have a lot of anxiety and stress, a lot of muscle stiffness, a lot of muscle aches and pain. Okay. And then one other herb that gets overlooked for fibromyalgia a lot is the valerian root, which is different because it's a really hot, somewhat spicy herb. Not spicy, I guess, but more hot and aromatic. So valerian root is a sedative. So this is especially good when people are having like insomnia because of fibromyalgia, muscle aches and pains, and a lot of muscle spasms, and that's keeping them out of that. This is where you need like level 10 herbal muscle relaxer. This is going to be one of the best things.
So when you talked about this for helping people sleep, you said about 1/5 of the people who take it, 1 in every 5 people who take it, it's going to actually wake up.
Mhm.
Is it in 1 in every 5 persons? Is it going to work for everybody with fibro, or is it again 1 in 5?
Yeah, most of the time, this is still going to work for the fibro aches or pains. However, it's a hot herb, so the 1 in 5 is usually someone that has a really hot constitution. So we usually wouldn't give it to them. Mhm. Or if we had it, like if we combine valerian with these other 3 herbs, it's gonna kind of have it's gonna cool off the effects and be a little bit more of a balanced formula. So we could still use it in formulation, but its sedative effects can be very strong for people, and the muscle relaxing effects usually happen on everyone that takes it, even if they get provoked in other ways. But remember, it provokes the mind.
So
Some people.
if you took this midday for fibro, is it going to make you sleepy?
Valerian will make people a little groggy, but it's nothing like it's not like a sleeping pill or sedative pill. Nothing like that.
Okay.
Not that strong. Okay. Okay. There's other herbs in this category, but these ones are so darn reliable. I mean, you don't have to know a lot of other ones. Just one I would say. Okay. It's important to know one quirky fact, and that is that typical anti-inflammatory herbs and pain relieving herbs will not do anything for fibromyalgia. Like you can give people willow bark, like aspirin-like compounds. It just doesn't do hardly anything for fibromyalgia. You can give people other like nerve pain type herbs, and it just doesn't usually do a lot.
So skull cap doesn't.
Okay, does help, but more because it's for the muscle tension and stiffness, so. Skull cap would be in this category traditionally, but it's gonna show up when we talk about nerve herbs. Yeah, but skull cap would be here traditionally too. I'll put that in there in the notes. Okay. So sedative herbs. Okay, do we have time to do sedative? Quick run through the sedatives. That's gonna be one of the main categories we're gonna do. Sedative herbs are gonna be for what type of pattern? Super muscle tension, right? More extreme anxiety. All the symptoms worse at night. Insomnia is obviously going to be a big part of this. Sometimes we just remember sedatives that are herbal are not like sedative drugs. These are just stronger nervines. Just think of them that way. Okay. So again, valerian's going to show up at top of the list. But hops is one that's really exciting. This is one of the top probably 5 or 6 herbs for fibromyalgia. Why hops? Why is hops so cool?
Because it relaxes the body.
Because it's a muscle relaxant, right? And it is a pain reliever, and it kind of interfaces with CBD receptors in different ways too. We have some different alternate pain relief properties, but it's also very nervine, very calming. And hops is actually relaxes the muscles directly. So it is like an antispasmodic also. Okay. But it's fairly strong and quick acting. The other herb that's in this category that is really powerful for fibromyalgia, but difficult to use, is nutmeg. Let's see. This is a really powerful sedative and very powerful pain reliever. It is not a muscle relaxer. It's more just a pain reliever for fibromyalgia and a sedative. The challenge is it takes about 2 to 4 hours to work. So typically, if you're going to do nutmeg, about the only way you can get it as a capsule, rarely. The tincture I have just found so far to be like way too strong. So it's just really intense. So the best way to do this is just take this as a powdered herb or make a capsule out of it. There's different dosing for it, but usually you would start with about 1/8 of a teaspoon, which is not very much. 1/8 to like 1/4 of a teaspoon. But 2 hours before bed. That's a pretty good clinical. Despite what people say, this is not a poison. You can't poison people with this. That's like all historical fallacy. No one's been poisoned with nutmeg. The dose you would have to do with it is so extreme. There's no way you could poison someone with it historically because you would taste it. It's so extreme. You have to do such a huge amount. It's just impossible. So some of the poisonings that have said that have happened with it, we know now are not true. It's just not possible. It's not that toxic. So But however, you can take so much nutmeg, you can get really, that's kind of slightly mind altering if you get like in the mega doses of it. So it is a strong sedative. The only challenge is the powder is about the only way I know how to use it. In Ayurveda, they would put the powder in like hot milk. That's another way to take it.
So you wouldn't put it in a small dose in a formula as a tincture?
You could, I just haven't worked with the tincture enough yet. It just seems really intense. So the powder works really well. There is one company that makes a capsule of it where you can make your own. And this you would just, buy the powder, you would just create it yourself and grind it yourself.
Yeah, my grandma used to grate it over a pot with the hot milk and then she would drink it before bed.
Oh, so it was her nighttime tonic, yeah.
Well, a little whiskey, but.
So that would be very traditional, a little nutmeg with some whiskey, as a hot.
But she was fresh grate.
Yeah. If you're gonna do it, I mean, for cooking, I mean, you want a microplaner. Or if you're gonna really use this, I mean, you should just microplane it yourself. Everybody knows what a microplaner is. Little chef, little microplaner. Just plane that fresh right into the hot milk or something. It's really good. You can put it in smoothies. I did that. This herb is not to be used in pregnancy ever. It is an abortifacient, essentially. So we do not use nutmeg during pregnancy or people who are about to conceive. I have seen a couple of people who like during the holiday season have like drank excessively like nutmeg spiced things that were pregnant that gave themselves bleeding. They never had a miscarriage, but I'm pretty confident that it created at least bleeding.
How do you feel about the essential oil?
The essential oil of it, I love topically for muscling. So the essential oil topical is a top for all-time fibromyalgia remedy, which we'll talk about too. Okay, so nutmeg is hot and spicy. So like valerian, it's not, most people need cooling, so it's not the most common thing that we would probably use. One last one is going to be California poppy. A lot of West Coast herbalists use this a lot for fibromyalgia because it has opiate-like compounds and the fibromyalgia tends to respond better to like opiate-like compounds. But I have never personally found this to be super sedative or super pain relieving to fibromyalgia personally. But so this would be a good pain relieving herb that is a stronger sedative to help with people that are having the nighttime aches and pains and all the stiffness and uncomfortableness at nighttime. Okay, so let's stop at sedatives. Okay, let's hold the course.